Welcome back to the show. Many thanks for staying with us. Now, tomorrow is World Drugs Day, and as part of the celebrations, the Narcotic Board will be engaging in activities that seek to educate the general public on abuse of drugs, especially, or let's say, the most popular drug now, tramadol, and trafficking. The theme for this year's celebration is Listen First, responsibility of parents to listen to their wards. Whatever that means, we will be getting into the mandate of NACOB in a bit, because it appears that you only hear of them once a while when they want to start drives like these. We're joined in the studio by the chairman of the planning committee for this year's celebration from NACOB, his Sylvester Kumsin. So thank you very much for coming. I hope you're well.
Yeah, I'm doing great.
Okay, so like I indicated earlier, it appears that we hear of NACOB once a while. That is if you don't have any cocaines to seize and you don't have persons to arrest. It's been a while. What has the NACOB been up to?
Thank you very much for the question. I don't think that is the right assertion, because we are doing a lot of things.
Okay, except it's not in the media.
Yes, because we know the media is more or less like sensational things, like when there's arrest.
We don't like sensational things. People like sensational things. We only give them what they want. So
when there's arrest, it's all over the place. But NACOB, per our mandate, we go far beyond that, because PNDC Law 236 that brought into NACOB to being, we have two mandates, what we call supply reduction, and then we have what we call demand reduction. Then the supply reduction, basically, we look at the enforcement and control. That is where we do the arrests. That is where people are arrested. We have officers who have been trained to mount our various entry and exit points, where we picked up people who engage in the illegal drugs. And mind you, our law does not allow anyone to engage in such activity. So we have officers in that manner. That is the arrest aspect.
Okay.
And then we have what we call demand reduction. That is where we engage the community, being we go to schools, we go to churches, we go to mosques, we go to community, any identifiable group.
You go to them, with a message, anti-drug message, if you
that's
like.
Right.
And that's what you're trying to do with this celebration that we're looking to. You are looking to start tomorrow. You're looking at tramadol. I spoke to the WHO representative for Africa not long ago, and one of the concerns that she raised was that as a country, we need to establish the extent of abuse before we can deal with it as we ought to. Does the NACOB have any such information on the level or the extent of abuse as we speak?
No. One thing, I think people are confusing issues with, especially when it comes to the tramadol.
Okay.
We know tramadol is a legal drug. We have to bear that one in mind. It's a listed drug where it's used for pain reliever. And all of us know but we have, we have the rate that you can take, the prescribed one, which is the 50 and then 100 milligram. But people go beyond that. Okay. And it falls within the domain of Food and Drugs Authority. Okay. To making sure that these right dosage are in the
can
market.
They do that without the help of NACOB,
yeah,
for
that's
example?
What so I'm coming. So we and Food and Drugs Authority are doing a lot of work together, collaboration to deal with the issue at hand now. So there have been instances where we engage in raiding, and our report arrested people with such drugs. So there are a lot that is being done about the issue of the tramadol.
Okay, speaking of a lot that's been done, tomorrow is World Drugs Day. You're looking to engage people. What is the strategy and what is your target? What exactly do you hope to achieve at the end of the day, so with which we, the taxpayers, can evaluate your efforts?
Thank you very much. We know, as we always say, that prevention is better than cure. Over the time, we've gone the way of, arresting people, putting people behind bars and all that. The tomorrow World Drugs Day, that is International Day Against Illicit Drug Trafficking and Abuse. The focus or the theme for the year is listen first. Listen to children and youth, which is a first step for them to develop in a healthy and safe environment. That's a theme. And this theme was the same as last year. And the reason is that Now, the international level realize that prevention is a very critical aspect when we want to deal with drug issue. So, what we are saying here, the meaning is that it is also a key responsibility of parents to listen to their children and the youth. And you agree with me that we don't have much time for our children.
But you see, the thing about making parents listen to their children, that is a fact perhaps that is taken for granted by a lot of parents. I'm wondering, what is it that NACOB is going to do differently? I mean, something unconventional, because it appears that something different makes a difference. So what is it that NACOB is going to do differently that will make the parents that you're targeting listen to you in the first place, so that they can then listen to their children?
Now our
afterwards.
Yes, we've already engaged in the parents, mind you. It's something that it's ongoing, and prevention is... How
are you doing that?
It's never ending. As I said, we deal with... Now we're even going to the extent of dealing with the PTA members, because we realize that at times some of the schools may not even give you the opportunity to go in there. So now we are tackling the PTAs. Once a PTA or PTA members realize the enormity of the situation, then they pave even more way to reach out.
That sounds good to me. Hold on for me. I'm trying to get a full picture of your strategy, NACOB strategy. If you can just lay it there for me so I can understand. Okay. I don't know if you get me. Yeah. What is the strategy? How are you reaching these people that you want to reach?
In terms of our normal activities, what we do, as I said, that we have offices across the country now. So what we are doing now is we are concentrating more, especially those in the region, demand reduction. Okay. Where if you say demand reduction, where we go into these communities. As I said earlier,
organized raids.
Not raid. Demand reduction, we don't raid.
Okay.
Enforcement is where we do the raid.
We do the raid.
But demand reduction is basically education, prevention.
Okay.
And then we don't even end there, where we deal with as I said earlier on, we go to the churches, we go to all these places.
Okay, so churches, then, PTA,
yes,
schools.
And then we don't stop there. We know there are others who have already found themselves in such situations.
Okay.
Where we have trained counselors who also go to these rehab centers to offer counseling services to these people who are living with substance use disorder.
Okay.
To help them to come out of the situation so that they can be meaningful within our community. So there are a lot of things that we are doing that we don't, it don't come out.
That doesn't come out.
Yes.
Is it working? Do you think it is working?
Oh,
because the wave of abuse of tramadol that we saw was quite alarming. It was as if it was like something we haven't heard of before in this country, the wave of tramadol, especially among young people. Is it working? Are the strategies of NACOB working?
Yeah, it is working. It is working. One of the principles of prevention is that you might, as I said earlier on, and it's a common saying, prevention is better than cure. You might have people who have already engaged in such activities. And again, you might also have people who have not, but who are potential to engage in it. So once you're able to go up there, rather than sitting perhaps in your offices or whatever it is, going up there to engage is a very critical.
Is there anything that NACOB needs that will make it much more effective than it is at the moment?
Let me say that we do a lot of collaboration. So the way drug issue is, you cannot deal with drug issues if you are an island on your own. So what we intend, or what we are doing, is to do more collaboration with other stakeholders so that we'll be able to deal with it, since the drug issues all of us concerned.
No, I'm asking about what it is that you think, if NACOB should have, would make you more effective.
In terms of logistics, as Oliver Trace, the government is doing its best, but Oliver Trace,
but you need more. But then that brings me to the question about, I understand that when people who deal in drugs are arrested, the NACOB gets to take over their properties that are acquired from drug dealing, etc., comes to the disposal of NACOB. Is that not working good enough?
It's not as easy as you just put it.
You get the courts to give you that.
It goes through the process.
But most of the times, those logistics have come to you.
It doesn't come to NACOB everything coming to NACOB just like that.
We understand that it comes to you, and sometimes some of your officials even get to buy some of them.
No, that's not true.
That's not true. One of your colleagues actually admitted here on this show before that he bought. Not that he bought, that there is a process that allows persons within the organization to sometimes get to buy some of these.
No. I haven't. I've been in NACOB over 10 years. I've never seen somebody buying maybe a property that has been seized from, what do you call it, a baron or whatever it is.
Not just a property, anything at all.
If it is auction, even, let me give you an example.
That's the thing. So they auction the stuff, then even the members, those who work at NACOB get to buy.
I acquired the last auction that was made. None of the officers bought.
But that's not the only auction that you have done.
Not something that I know of, honestly. I personally haven't even bought a pin from any.
Maybe you personally haven't.
But it doesn't happen.
But besides that point, is the fact that what sort of logistics do you think you need as we speak?
Looking at it, we do a lot of demand reduction work, of which we have to go into the community. Some we have to do what do you call it? We have to do the laptop. We need all those. There are things that I will not be on top of my head, not be able to tell you. But as I said, that even the advanced countries where they have all those things, still
fighting drugs is not. It's not such an easy thing. So tomorrow is World Drug Day. You have a lineup of activities.
Yes, this year is slightly different from what we've been doing.
Okay.
This year we are looking at engaging in media. Purely because we know that a lot of people follow media a lot. So this time, some years back, even last year, we normally have a derby.
Okay.
Where we bring in.
Isn't that more appropriate, where you get to touch the people, on the ground, rather than standing on top of them in the media and shouting out messages to them?
Not necessarily that. But this time I want to go in that way. So in all the regions, we have media going out into the media.
So you're embarking on an excessive media drive.
Media drive this time around.
That's it?
That's what we want to achieve. But besides what we've been doing, besides the media drive that we are talking about for this period, we're also doing our work.
If anybody is watching this interview, what is the one thing you want them to take away about dealing with drugs and about staying safe from drugs and about whether or not the NACOB is indeed on top of its game and protecting all of us from drug dealers and drug users, etc.?
Yes, thank you very much. First and foremost, we, as a parent, that is why the theme for this year and even the last year is very critical. As parents, we should be very, very, very mindful about our children. Some of us don't even know. From the time the children go to school and the time they close, that gap. Some of us leave home very early and come in very, very late. The time you are leaving, your child or your ward is asleep. The time you come in, the person is also asleep. So it's very, very critical for parents to take up responsibility. It's very, very critical. And again, in case you find your ward in such situation, maybe having this substance use disorder, that's not the end of the world. You can also contact and then help. We can also find a way of helping you to come up.
They can contact NACOB?
Or we have rehab centers that I can mention.
Okay, you can mention the rehab centers, and if there's any number that people can reach NACOB on if they have some of these drug issues and want help, you can put that out as well.
Okay, thank you. For rehab centers, we have a place like Pantan.
Okay.
Yeah, if you are within, we have Pantan, we have Dafere, we have Kolebu additive units.
Okay.
We have Compassionate.
Where is that?
Compassionate is somewhere Dowena mutual area.
Okay, Dowena, near Dowena.
Yes.
Okay.
That area.
Okay. So are those the only places?
Then when you go a place like Cape Coast, you have Mercy, we have Ankafo, and other places. So what is important is that if you find yourself in such a situation, once you get... If
you need help, you can go. So we're having a chat with NACOB. We're talking drug abuse or the use of drugs, and we're looking at how to deal with this issue. Even as tomorrow, we look forward to World Drugs Day. I've been talking to Mr. Sylvester Kumsin, who is chairman of the, is it Planning Committee? Planning Committee.
That
works, okay, of NACOB, and they're talking about how they're targeting parents. And actually the message that he's putting across is that parents must be much more aware of the ins and outs of their children, because that's where it actually starts. But if you have any drug-related issue, you have family, friends who have drug-related issues, and you want some help or you want that reported, he's saying that you can get to Ankafo, you can get to Kolebu Teaching Hospital, you can get to Compassionate, which is around Dawenya, you can get to where else? Dafari. Where is that?
That is somewhere Pokwase.
Pokwase. So there's also a place in Pokwase. But you can call this number if you want to get through to them. What's the number? You don't want to put out the number?
Not really.
Okay.
0299
0299
401
326. So this number is it like an open number that you can just call and make a report?
Yes.
Or ask for help? For real?
So that we can give you
because
direction.
you weren't quite sure about giving the number out in the first place. So I'm a bit doubting.
Don't be that. Don't doubt.
No, I'm confused. Is this an open number that everybody can give a call?
Yes, if you call, you get it.
Okay, well, I have my own doubts, but it's not in my place to have doubts, right? The number is 0299 401326. That's 0299 401326. 401326. If you have a drug issue or drug-related matter, you can give them a call. And perhaps you won't speak to Mr. Kumsin, but someone else will speak to you. Mr. Kumsin, thank you so much for coming. And we hope that going forward, all the right things will be done.
Sure.
And this country will rid this country of all the illicit drugs.
Thank you very much.
Tomorrow is the day, World Drug Day. Stay safe, and stay away from tramadol. Stay away from all of those drugs that are at your disposal. They can be very dangerous to your health. And talking